Hello and welcome to the using the Data Security and Protection Toolkit for the first time. I'm just going to hold fire till for a couple of minutes just to allow everybody to join, and then we'll start. Okay, just going to give it another minute and then we'll kick off. Because I know you'll all be waiting, ready. Okay, I think I'll start now. Not to worry if anybody joins later, we'll send out the slides and notes anyway. So welcome to the first webinar of 2025 on using the Data Security and Protection Toolkit for the first time. This is for people who have not previously completed or published a toolkit, and we're going to help you to understand the toolkit and plan what you need to do to complete it. We're not going to go through each question on the toolkit, but we will be signposting you to useful information and direct free support on completing the DSPT toolkit. Next slide. Oh, sorry, you've gone to the next slide. So, technical issues. These are for people who have never published the DSPT in the past. Attendees are on mute and can't be seen. Please use the question and answer function to ask questions. I have a couple of colleagues from the national team who will hopefully be answering your questions in the Q&A function. On a phone, tap the screen to see controls and choose more, and then the question and answers will come up. Questions that we can't answer today will come back to you. So add your email address and then we can get back to you on that. The webinar will last no longer than an hour and you will get access to the recording and the presentation, including all the links. Okay, if we go to the next slide. I seem to have lost. Just bear with me 1 second. Okay, so the next, just bear with me. So today's agenda, welcome. My name's Angie McNally and I work for Oxfordshire Association of Care Providers, and I'm one of the 28 local support offices that will support adult social care providers in completing their DSPT. We're going to be looking at registering your DSPT, how to complete it, how to publish it, and the support that's out there for the Better Security, Better Care programme. If you can just bear with me, sorry, my screen's gone. Okay. I don't know what's happening here. Right. Okay, so next slide, sorry. Cyrus. Okay, so we're going to be looking at a poll here. So if you could just take a few minutes to answer the questions here, and that will give us an idea of where we are. So the first one is your service always registered? And if you don't know, don't worry. Is your organisation registered? Have you started the DSPT? And how would you describe your organisation? So are you a multi-site organisation or is there just a small one? I'll leave that a few seconds and then when you're ready. Oh, there we go. There we go. We've got it up. So we can see that 46% of you are registered. That's great. 31% have started it. Fantastic. And the majority of you are single site. That's great. We have different links for multi-sites and single sites, but we'll go into those later. So the next slide, please, Cyrus.
Better security, better care with the Data Security and Protection Toolkit. As a care provider, you store and share important and often sensitive information. This includes data about the people you support, their family and carers, through to staff, partners and funders. To store and share that information, whether it is on paper or digitally, all care providers must have systems in place that reduce the risk of cyber attacks and information breaches. If you don't, your business and reputation could be at risk, and you could be breaking data protection law. The Data Security and Protection Toolkit, or DSPT, is an online self-assessment tool. You can use the toolkit to check your data and cyber security policies, procedures and practices, and demonstrate that you have good systems in place. This can reduce the risk of a data breach and the risk of a fine if a breach occurs, as you will be able to show the Information Commissioner's Office the steps you are taking to reduce and manage risks. All adult social care providers in England, regardless of size, service type or ownership, should complete the DSPT at least once a year. When you have completed the toolkit, you can publish and share information about the standard you have reached. So what levels can you reach on the DSPT, and what do they mean? There are currently 3 levels on the DSPT. Approaching standards means you are meeting minimum legal standards. It's a temporary stepping stone to the next level, and you will need to produce an action plan to show what you will do to get 2 standards met. Approaching standards also enables you to get NHS mail, an accredited secure email system which helps you to share confidential information with local authority, NHS and other colleagues. Standards met is the level you really need to reach. It demonstrates that you are going above basic legal requirements, and it helps you to take some proportionate measures to protect you from cyber criminals. It will help you to reassure people who use your services, their families and your staff that you are managing their information safely. It will also enable you to answer the Care Quality Commission's questions about managing data. And if you are accessing NHS patient data or delivering services under an NHS contract, you must have reached standards met. Local authorities are also increasingly asking for the DSPT in their contracts. Standards met opens up access to shared systems with other health organisations, including GPs, hospitals and pharmacists. These systems can improve decisions you make about someone's care and save your staff time. Finally, standards exceeded indicates that you have gone beyond required standards. So, for example, you may have Cyber Essentials Plus in place. As a care provider, you should complete the DSPT at least once a year, but we know that not every care provider feels confident about using the toolkit. To support you, the NHS-funded Better Security, Better Care programme provides direct support, as well as useful guides, templates and a helpline to enable you to publish your DSPT and to protect the vital information you store and share. To find out more, visit www.digitalsocialcare.co.uk/Better Security, Better Care.
Great. We're going to go on to the next slide. That's great. Your toolkit journey starts now. So we're going to look at it in a little bit more detail. But first of all, we're going to look at how to register, then how to complete and how to answer all 43 questions. We're going to give you some tips on that. If you're publishing to standards met, there's 43 questions. You should really aim for standards met, but if you can't get there in one step, because we know there's quite a lot of detail that goes into it, you can publish to approaching standards, but you must include an action plan about how you will get to standards met next time. You can only publish to approaching standards once. And it says they are review every year, but things change all the time. So staff, systems, organisations. So to ensure that your DSPT reflects how you currently operate, you do need to complete it at least once a year. Ideally, I say to my providers, it's a working document. You should, if anything changes, you should update your DSPT, and you can do that at any time. So if you introduce any new data or records systems or open a new service, it update and republish. And again, like I said, there's plenty of help out there. So if we go on to the next slide, as you'll see, you're not alone, okay? Better Security, Better Care is the official partner on the DSPT. The programme is paid for by NHS and includes online guidance, templates you can use to update your policies, helplines and tailored direct support from 20 local support partners across England. And as I said, Oxfordshire Care Association are one of those support partners. At a national level, Digital Social Care is providing guidance, helplines, support to large providers. So you can see here that you'll get this through when you get your slides, but the Digital Care website provides lots and lots of tips and templates and guidance to help you. Also lots of different webinars, so don't just think this is the one webinar. There's lots of in-depth webinars coming up, so make sure you keep updated with what's on offer for you out there, because it's all help for you. Okay, so the next slide. And just a little point about CQC and the DSPT. So one of the points that we wanted to highlight is the value of the DSPT when providing evidence to CQC. This really does apply to all care providers and is increasingly important. And you will have heard in the video that local government associations are now looking at, so your commissioners are now looking at it. And one of the local authorities that I work with have brought it in as mandatory that you must complete the DSPT. So you may find that your local authority bring that in the next few months. So the CQC will increasingly expect a good provider to comply with Data Security and Protection Toolkit or equivalent as a minimum. This also applies where you use a combination of digital and paper records. So please be aware that DSPT also covers not just digital but paper records. The DSPT is now a requirement under the Single Assessment Framework under Well-Led Government's Management and Sustainability. And you can read a little bit more about there on the link, as I said, that you'll get with the slides as they come through. So the next slide. So we're going to look at how to register for the toolkit. I'm going to help you understand and plan what you need to do. Okay, so the next slide, please. So all CQC registered social care providers will have an ODS code, which is the Organisation Data Service Code. And this is used by the NHS to provide health and social care organisations with a unique code. And you'll see the sort of timeline here. So the first thing to do is to find your ODS code. And I'm going to go into a couple of ways how you can do that. And then you want to choose the ODS code that you want to register with. Then you complete the registration. You will get a link in the email, and then you can set up your own password. Okay, and we'll just go into that a little bit more. So as we said, the next slide, yeah. So the first thing you need to do is find your ODS code. Every organisation, for every organisation, there's a head office code plus a site code for each site. So you'll have two codes, even if it is one site. It's the strange way it's set up, but not to panic, okay? So for single sites, for example, you should register with your V code, okay? So you will have an A or a C code, which will be your head office, but your V code will be your single care home or home agency site that you will register with. Yeah, so just ignore the A or the C code. And if we go to the next slide. And if you're multi-site, and there was a couple of multi-sites on here, so you're a group of care services, you will register with your A code. So this could be a small group of care homes. There is a head office code and then a site code for each site. So there'll be a V code for each site. If the organisation has the same arrangements for the data and cybersecurity at each site, then you need to then all you need to do is complete one toolkit entry. This makes life a lot easier, okay? And use the head office code to register. This option only applies though where arrangements for data and cybersecurity at each site are the same or very similar. So for example, where there's a single type of service offered across business, this example applies. And more on that later, okay? So if you've got a head office in A and you've got single sites that have the same arrangements, then you register under your A code. And the next slide, please. Okay, so to find your ODS codes for more complex multi-sites, for example, if your organisation is a more complex, for example, it offers different types of services, perhaps including some services that are not regulated or has many main offices or branches, you'll have more than one head office code and multiple site codes. You'll need to complete more than one toolkit entry and you'll need to seek advice on that. You may have several head office codes for different parts of the business, e.g. if different types of services are offered, or they may have different CQC registrations, or if you have different legal entities, even if there's similar type of services due to acquisitions of other businesses. So it can get a bit complicated. So under the BSPC programme, you can currently seek advice from your local support organisation, or you can seek advice on the DSPT Exeter helpline, and you'll see the links there. I would say it's best to contact your local support officer and they will be able to help you rather than struggle and try and do it yourself. They will either be able to help you or point you in the right direction. Okay, and the next slide. So for multi-site changes in the DSPT 22-23, you would tick all the sites you would like to publish on behalf of. Add your registered managers as viewers or auditors, and we'll go into that in a little bit more detail in a moment, and revisit and publish every year or as and when things change, okay? So this is an example of what you would see when you come to register, okay? And to find your ODS codes, you would go to the ODS portal and choose the organisation practitioner search. If you cannot find your code or aren't sure, then contact the Exeter Help Desk again. Again, the number and the link is there. Non-regulated services may not have a code. In that case, you would have to contact Exeter. If you're not clear on what code you to use or cannot find, again, contact Exeter or your local support office. Services which are closed may have registered their businesses, but that's not all. The reasons are not always clear. So just make sure you know that you're registering the correct business, because sometimes businesses slightly change names and come up with so make sure you're using the correct ODS code for the correct provider. The next slide. Okay, so this is finding out how to register for your DSPT. So the first thing you want to do is click on the link, the DSPT Toolkit. Again, that will be sent through to you, or it's up there on the slide. This will also tell you if your organisation has already completed or published a toolkit and when. If not, you will need to register the toolkit. So if you need to register, then you would click on the register, which is ringed in red up the top right-hand corner there. And then if we go on to the next slide, that's a little bit more detail. When you register and log on for the very first time, you'll be asked to complete the organisation profile to choose the most appropriate sector for your organisation, to provide details of the key roles and whether you have any relevant certifications. The answer you give here will tailor the questions to respond to in your assessment. You can change your answers answers later and will be prompted to check this information when published. We suggest that you only choose your organisation type at this stage. Important to stress that it cannot be gone back into at any part and updated. So you can't change your organisation. So always choose a social care, and then you'll get the correct 43 questions that you need to answer. They will be marked mandatory. Otherwise, you could end up with questions that are not mandatory for this adult social care section, because the DSPT covers others. So not just adult social care providers, so it covers doctors and etc. and pharmacies. If you answer the other questions, if you answer the other questions on registration, you'll be asked about the key roles and if your organisation has NHS Mail or Cyber Essentials Plus certificate. If you know, then this is fine and you can answer it. Otherwise, select not sure if you're uncertain, and you can leave them blank. Okay, so you'll see that when you click in, you'll see on the screen that there's different types. Always choose a social care section there, and then you'll get the correct questions. Okay, and again, there's links there to help you. And if we go to the next slide. You might share your work on the DSPT with several people, and I would say this is a really good idea, because it saves it falling down to one staff member. It also means that other people are able to answer questions should they need to. So as an administrator, you can add more users and assign their access level. So sign into the DSPT and click on the admin option. This will reveal a drop-down list and select Manage Users. This page will list all the people who have access to the DSPT. You can add a new user or edit the permissions for existing users. So you could have somebody or people that are auditors, so their view only access to the evidence items. It means they can look at them and check that the answers, check they're correct, check where to find things, those sort of things, but they can't change anything. A member can edit evidence, but not create new users or publish toolkits. So you may give it to your IT department and ask them to complete the questions on the IT, and they can complete them there, but again, they would not be able to publish them, but the answers will be there for you to see until you can publish them, yeah? And then administrator, which would be yourself, whoever registering, full access to the toolkit. So that means that you can add new users and you can publish your toolkit. When you do this, you will then be sent an invitation link. This expires within 24 hours, so you have to reply to it within the 24 hours. And just to reiterate, only administrators can publish a toolkit and add new users. Again, when you add a new user, they must respond to the link within the 24 hours. And if you haven't received it, get them to check their spam folders, because sometimes it goes into there. Okay, and the next one. Again, a support on registering there. So use your local support organisation, or look at the website, and the links are there and you'll get those. So I'm going to skip the next one because it's questions, and hopefully the questions, if you've got any, you'll be putting them in the Q&A for
we
Rihanna.
do have a couple of questions, Angie.
Okay, yeah.
A couple that I wasn't able to answer, so I'll just pass them over to you. One question says that they're a charity that doesn't hold patient data, and they may be looking at other work, but they want to know if they have to complete the DSPT, given that they already have Cyber Essentials Plus. And additional information they've added is that they don't have, I'm not sure what this says, it says we don't any site, our charities are all home-based workers, and do we need to say that they're a single or multi-site or submit their mailbox to head office address? So
Okay,
in there.
yeah, that's a bit complicated. So the charity, unless it's CQC registered, it's only if you're CQC registered, it's mandatory that you do the DSPT. Excuse me, sorry. However, you can register for the DSPT. You can, but you would need an ODS code, which you would need to contact Exeter for. Sorry, I've got right tickle. And once you contact Exeter, they would be able to tell you if you were going to be classed as a single site or multi-sites. So that would be my advice there would be to contact Exeter and talk to them, and they'll be able to help them more. Is that okay?
Lovely, thank you, Angie. And just on the part they mentioned about Cyber Essentials Plus, as they have Cyber Essentials Plus, will they still need to complete the DSPT?
Again, well, it depends whether they need to you can fill if you've got Cyber Essentials Plus. I think when you fill in your the details at the beginning of the DSPT, then it'll take out any questions that you don't need to answer. But again, Exeter will be able to help them with that one. I'm thinking that because they're a charity, if they're not CQC registered, they probably don't have to complete the DSPT. And if they've got Cyber Essentials Plus, they should be covered there. But again, check with Exeter because they're the font of all knowledge.
Perfect. Thank you so much, Angie. And then just one more question. It says that they are a software supplier to the NHS and they need to register for the DSPT to allow them to get HSCN connection to support NHS customers. They said, I guess this would be an NHS business partner. Just want some clarity on that.
Yeah, that's a bit of a strange one. Again, I would say contact Exeter. They will be able to let them know. I mean, if they were in my area and they came to me, I would go to Exeter and just get clarification on that. So I think they're right. There'll be an NHS partner, but just to get clarification, go to Exeter.
Perfect. Thanks so much, Angie. And that's all
Okay,
the
no
questions.
problem.
And the all of the links and email addresses, including Exeter, in the presentation as well. So you'll all be sent that at the end.
Thank you. Okay, Cyrus, so we go on to the next one. Okay, so we're going to be looking at completing the DSPT questions. Okay, I'm going to help you to understand how to do this. And then if we go to the next slide. So please remember that when you answer this, your answers are not public. Okay, this is a self-assessment. Only the status is published, so nobody can see your answers. The only people that can see your answers are those that you have given authority to see them. Please be aware this is not a tick box exercise, and you'll see that the questions are set in different ways that it's obvious it's not a tick box, but use it to work through what you need to do, okay? And it's also good, especially for those new, to make sure are new to the adult social care providers, then they can make sure their policies are up to date and up to scratch, and are robust, and they are ready for them to be used. Okay, so use the answers and comment sections to record valuable information. So again, as we go through the questions, you'll see that each question has a comments box. It's not always mandatory that you fill it in. However, whenever I talk through the DSPT with any of my providers, I ask them if they can to fill in details that will help anybody who comes along to either view it or to audit it or whatever. Any information that you can put in these will help you and help you for your next publication. So while it might seem a little bit long-winded initially, once you've done it the first time, then it will become much quicker. Okay, next slide. Okay, this is a screenshot of what the toolkit looks like if you choose social care as your organisational type. Questions that are marked mandatory are the ones that are part of approaching standards. Questions that you have answered will be marked as complete. There is no specific order for completing the DSPT. You can start anywhere and move backwards and forwards between the question. The system will auto-save at regular intervals. Okay, so you can come back to it, you can log out and come back to it. You don't have to do it in one sitting. You can break it down into sections. So as I said, this the different sections there, you'll see. Under each section, there are several questions or evidence items. And depending on the type of questions, you will be asked to either upload a document or write some text to answer the question, or state what date something happened, or just tick a box to confirm your organisation does something, like provide induction training to all new staff. To complete a question, you click on the blue writing. So you'll see the numbers, if you look at your screen, you'll see number 1.15, and then you'll see blue writing, who has responsibility, and so on. If you click on that blue writing, that will bring up the question, okay? You will also be able to see the best practice advice on answering this and what you should be doing. Beware that the DSPT is split into 4 sections. So you've got your staffing, IT. I'm just trying to think what they are. We'll come to that. You'll see them in a minute. But there's 43 questions to get to standards met. Okay. And if we go to the next slide. Okay, policies and procedures. There's another one. Okay, so we've talked about this. Click on the blue item, and this will give you the evidence, and this is the evidence item to answer the question and see the guidance there. Okay, so here are your 4 headers. You've got staffing and roles, and there's 4 questions to get to approaching standard, or 7 to get to standards met. If you go to the next slide, sorry, that's there. The policies and procedures, there's 10 questions to get to approaching standards, or 12 for standards met. Data security, 5 questions for approaching standards, 8 for standards met. IT systems and devices, 7 for approaching standards and 16 for standards met. Okay, so staffing and roles have a named person responsible for this area, and that your induction and ongoing training covers data security and protection. So that's what this covers. Policies and procedures, does what it says on the tin. It's being registered with the ICO, having data protection policies in place, having record retention schedule and privacy notices, and following good practice around destruction of records and computer equipment. Okay. Data security, this is having good building and physical security in place for your paper records. Plans for what to do in case of an emergency, and this is really important, e.g. losing power or the internet, or managing data breaches, well, if something happens. And then your IT systems and devices. Having basic IT good practice will cover most of these questions, e.g. antivirus software. But small organisations can often struggle here, including not knowing what to look for in an IT support company. So part of the benefit of the DSPT is about making sure you're equipped to ask the right questions by following what the toolkit asks for. I'm going to look at the questions in a little bit more detail. So if we go to the next one. Okay, so staffing and roles, what the questions cover. Okay, so there's 3 main areas, and we've got the responsibility. Before you approach the whole topic of data protection and cybersecurity training for your staff, you need to decide who will be responsible for this area of your business. Okay, so you need to have one dedicated person. Staff records and contracts. Do you know what the staff have, and do you have something in their contract about keeping data safe? Okay, it might be that if you're a large company, you might have an HR department, you might need to, discuss with them. And the DSPT asks 4 questions regarding training. So what training do your staff need? Depends on the role. So you'll need to carry out a training needs analysis covering all staff and find the right training materials and providers for your needs. All staff will require some level of training in data protection and cybersecurity, and this will include frontline staff, managers, owners, board members, and volunteers if you have them. Different levels of training will be needed dependent on the role, and the staff for the roles involving data security and protection will need in-depth training, okay? Because they're going to be your cyber champions. They're going to be the ones that are going to help when anything goes wrong, or just help and train others, okay? So for approaching standards, you must make sure that the data protection and cybersecurity forms part of every employee's induction. Okay. And if we go to the next slide. So we're going to have a look at one of the examples. It's important it's important to keep up to date the records of both your staff and volunteers if you have them and their roles. This list should keep track of any changes of their role, any new starters, any removal of leavers, and this might be linked to your existing payroll or rostering system. Okay, and the next question, this is question 4.11 on the toolkit. Does your organisation have an up-to-date record of staff and volunteers if you have them and their roles? So you don't have to upload the records to the toolkit, but you do need to have them in place somewhere on your system, or if you're using paper files, in paper files. So in the toolkit comments box, you can describe where the records are kept. For example, in which office, cabinet, computer, or where on the computer. And if we look at the next slide, you'll see there, showing it is the last question. You'll see the mandatory there on the right hand side again. You click on that, and if we go to the next slide, then this comes up with your question. Okay, and here, this one is a tick box. So you would, if you have this in place, you would tick the box, and then in the comments box, you want to put a response. And if we go to the next one, this is an example of a really good response. So they've ticked yes, and staff and volunteers register are contained in HR files, both hard copies and electronic versions, which are saved on both Google Drive and Portable D Drive in the Operations Director's Office. The hard copies are kept in a locked drawer. Okay, so that's a really good example of what you want to put in there. That makes it nice and easy. One, if CQC come in and want to have a look at you can let them have a view-only aspect of your DSPT, and they might pick out some things that they want you to prove, provide evidence for. So again, when CQC come in, I know from working in a school environment, when Ofsted come in, everybody's nervous, regardless of how well you're doing. This just takes that onus off you of where you're trying to think where things are. So you can just refer back to this and you can say, oh yeah, these are kept on the Google Drive, blah, blah, blah. Okay, so really good practice if you can put something in there. And the next slide. This is an example of a text question, okay, where you have to write something in the yellow box. The tooltip shown here below the question is the guidance and advice. You only see this when you actually go into the question. So when you click on the blue question initially, this is what comes up, okay? What you write in the comments box doesn't count towards your answer. So if you put something in comments optional there, that won't say that, well, it will say, but it won't be part of your answer. It doesn't say that you've completed that question. Then you must put something where the yellow box is, and you can see here where it says write your answer. It's useful for function though, and we would recommend it's used to come back next year to redo your DSPT. You may not remember why you answered a question in a certain way and where the policy is saved, etc. Or if you leave it and someone else takes over. So again, while you're still writing something in the yellow box, add a comment. The next slide. Okay. Awareness training. So one of the questions, 3.21, have at least 95% of your staff, directors, trustees and volunteers in the organisation completed training on data security and protection and cyber security in the last 12 months. Okay, so again, this is a mandatory question. And if we go to the next slide, we have help for you for that. We have a free e-learning course for all staff working in adult social care that will cover your data and cybersecurity training. It's easily accessible. It's 15 to 20 minutes per module, and there's 4 modules. The relatable case scenario based. As we said, it's learning for all staff. It's free. It's compliant with question 3.21. And it was written and is the only free e-learning site for cyber cybersecurity and data protection within adult social care. So it's specific to you. So each scenario is set in an adult social care situation. So it's really relatable. As I said, it's only the 4 modules. So one on data protection rights, one on keeping data security secure. The third one's on threats to data security, and the last one's on data breaches. And if your staff go through those, there's a questionnaire at the end, and if they score more than 80%, then they'll have passed and covered their training for that year. Okay, and this can be used in connection with the manager discussion tool and quiz. So you can use these in your staff meetings. You can break it down. You can do a 10-minute one on data breaches. Or so again, it's based on the 4 modules. We know that training is a challenge for providers, so we've created a discussion tool for managers to use with their staff on data protection, plus a basic self-assessment tool for frontline workers to use to demonstrate their knowledge. This can help you answer questions on training, but can't guarantee it. But again, as I said, it's really good use. I always suggest that my providers use it ad hoc within the year, and maybe revisit things. So if they've had a data breach or something, maybe revisit that section of it. You know, it's just really good tool to use parts of. You don't have to use it as one all the time. Okay. And the next question, the next one.
Sorry, Angie.
Sorry.
Just to pop in as well to say, we are launching another e-learning training, and it's specifically for the data leads in organizations. Probably should have put an extra slide in there about that. But we have a launch event on the 23rd of January. It's online, virtual, and we'll send that out with these slides at the end in case anyone's interested in that as well.
Thanks, Rhiannon. That's great. Yes, I forgot about that. That's launching on the 23rd. And I know a lot of my providers have been asking about training for those that are responsible for data security. So if you are completing the DSPT toolkit and you are the person, or you know of the person, then point them in the direction of the webinar and join us on the 23rd. That would be fantastic. Okay, so we're going to look at policies and procedures and what the questions cover here. So policy and procedure group of 12 questions at the heart of GDPR and data protection. So the first thing is the ICO you need to check you're registered, and you must be registered. You're going to look at policies, what policies need to cover to help you keep data you hold safe and secure, and how you would check they're being implemented by auditing or doing spot checks. And this includes new question 1.24, which is from July 22. It's a legal requirement for all health and social care CQC registered organisations to be compliant with the National Data Opt-out. So the National Data Opt-out gives everybody the ability to stop health and social care organisations for sharing their confidential information for research and planning purposes, with some exceptions such as where there is a legal mandate or direction or an overriding public interest, for example, to help manage the COVID-19 pandemic. As a provider, you should help people who use your services to understand that they can opt out of their data being used for other purposes. You should check that your policies, procedures and privacy notice cover the opt-out. And the National Data Opt-out is required for standards met. Okay. We also look at holding and sharing information, retaining records, disposing of records and equipment, and the list of suppliers. So go on to the next one. So as I said, Information Commissioner's Office, it's a legal requirement for every organisation that processes personal information, unless an exempt small charity, and this is very unlikely for a care provider, you must be registered. If your organisation is not already registered, you should register as a matter of urgency. The ICO fine is up to £4,000 if not registered. And I don't think it's very much to register. I think it's under £100, and that covers you for the year. You can check whether you're registered on the Information Commissioner's Office website. It's nice and easy to do. And if you haven't registered, then make sure you do. You will be given a code when you register, okay? And if we look at the question, okay, so what is your organisation's information commissioner's or registration number? And you'll see on the screen it there, and you'll see a yellow box, and that's where you would put in your number there. And if we go to the next screen, you'll see how it's filled in. Okay, so in the yellow box they have put, we have an ICO certificate on our wall, ICO registration number, blah, blah, blah. And then they've put the date that they were registered on, because that will also remind them that they need to renew it, make sure it's renewed as and when, okay? I'll go to the next one. So there's further support. So the Digital Care Hub, sorry, has lots and lots of templates to help you with policies. And you'll see there's a whole stretch there that should you need either just to check the wording of yours, or if you haven't got one in place, you can use it. Make sure you adapt it though to your premises, your company, because we see a lot of them where they've just taken the template off a generic site, either from ourselves or from a company that supplies policies, and not changed dates and names and all sorts of things. So make sure you make it relevant to your own company. Okay, and then next slide. So data security. In the DSPT toolkit, there are 8 questions in this section. Okay, data breaches. So 6.11 asks, does your organization have a system in place to report data breaches? There other 3 questions about data breaches are about what you did if you did have a data breach. So if you haven't had one, you can answer not applicable there. It's going to ask you about your building security and your paper records. And it's going to ask you about your business continuity, how to make sure you've got the information you need to keep the business operating when something happens to the records that you hold. So, for example, how do you tell your staff where they need to be if the computer breaks down, or if the internet stops working, or the online system stops working? Okay, this is really important. Okay, and that's something that might need a big push on make sure your business continuity plan is robust, because we've seen a lot where they didn't include anything on digital. They had things about floods and fires and such like, but nothing on digital. Again, look at our templates there and they will guide you. Okay, if we're going to the next slide. Okay, so IT systems and devices, and in the toolkit there's 18 questions in this section, and 6 main areas. So there's people and access to their information, passwords, backups, protecting your equipment, including a bring your own device policy. So if people are using their own smartphones, you must have that in place, okay? It's technical setup and support, and what documentation should your suppliers have? Okay, so that's IT suppliers. You want to make sure that they've got insurance in place as well. Okay, and they've got a cybersecurity policy in place. And the next one. Okay, so there's a new mandatory question, MFA. This has just come into play this year. So it's 4.53. It says, MFA is one of the most effective ways to protect data and accounts from unauthorised access. And you'll see it yourselves on your daily and your personal use with banks, even your NHS app, your doctor's app, those kind of things. You should consider all systems that can be accessed from the internet, such as your email, your digital social care records, and any cloud-based or online systems. And there's guidance there, that again on the link can be found on the Digital Care Hub. And we'll go to the next slide. So, as we said, MFA is a way to make your online accounts much safer by adding extra steps to prove it's really you trying to log in. Usually this is a text message, email code, fingerprint, or authenticator app such as Microsoft. You've probably done this when online banking or logging into social media. Ensures we keep us all safe by allowing only people to have access who should have access. Okay, and the next one. So review your current systems and speak to your suppliers. What you want to do and identify any potential issues. So is there staff sharing devices or logins? Identify where implementing MFA might not be appropriate, e.g. if there are already other significant controls in place. Decide on your organization's balance of security versus usability. Okay, so don't just put it in place because you think it should be. Make sure that you're still allowing usability of your systems, because what we find is people will find a way around it anyway. So if they find it unusable. So make sure that you create that correct balance between security and usability. And note any systems without MFA at director or board level and why. So if there's any of your systems you haven't, you've decided not to use MFA on, why have you decided not to? And then you have to get a director to sign that off in a board meeting and have that documented somewhere and easy visible. Okay. And it's important not to go overboard. So as I said, systems must be usable. Adding too many layers means people stop using systems or find workarounds. Identify the appropriate level of security for each system based on sensitivity of information and your appetite for risk as an organisation. Where appropriate, MFA should be implemented for all individual logons to the system. Use the support available, so talk to your local support organisations, software suppliers or IT suppliers. There's guidance out there for you. Okay, and the next slide. So as I said, there's further guidance on the Digital Care Hub website, and you can contact Better Security, Better Care local support partner, and they're listed. So they're in area. So if you log into the Better Security and look for your area, so if you're based in Oxfordshire, you would come to us. If you're based in, I don't know, London, you go to the London one. If you're based in Essex, you go to the one that covers Essex. So as I said, they're, you know, then nationally covered. Their areas are covered all over England, okay? And visit the Digital Care website for your guidance, register free updates. There's lots of help there, you know, so don't be on your own. Okay, so the next bit we're looking at is publishing your DSPT assessment. And if we go on to the next slide. Okay, so if we were going to publish at approaching standards, you would have to have answered 26 mandatory questions. Once you get down to the end of the questions, you will see Publishing Approaching Standards Assessment in blue. You would click on that, okay? You would need to, if you're publishing to approaching standards, you would need to complete an action plan that shows you how you will complete the rest of your questions. If you're stuck, I would suggest contacting your local support organisation. It does tell you how to do it when you come to publish, but I often find people get confused about how to do it or what they need to put in there. So if you go to your local support organisation, they'll be able to help you. Okay, and the next one, if you're publishing to standards met, you would have answered all 43 questions. Click on Publish Assessments, and that will publish if everything's okay. Just remember it's only your status that's published, so not your answers. So nobody else can see your answers, okay? If something's gone wrong, if we go to the next one, it will come up in red and it points out what's gone wrong, okay? So in this one, 2 questions haven't been completed correctly. It could be that it's a tick box and it also needs some kind of information downloaded or a written comment, or it could be that you've just missed it by mistake. So you could just click on these and go back to them and correct them. Okay, so nice and easy there. Go to the next one. If you were doing a headquarters assessment, you publish for all sites. So you can view your branches. You'll see it comes up, complete your headquarters assessment, and then view the branches. And you want to just double check that your completing for all those branches. Do they have the same policies and procedures? And if that's yes, then you publish for all sites. The next one. So again, further support on publishing is there. So these links again will be sent to you. Once you're published, export your assessment to Excel. Okay. And again, there's a link there that you just click download assessment, and the Excel file will download into your device straight away. Okay. If we go to the next one, and save your published DSPT as a PDF. So you can save this. Again, it's down there. If you've published to standards met, you can also download your certificate. Okay, so you get a certificate that you could put on the wall. And if we go to the next one, okay, so this is a copy of a certificate, and it shows what date you published, and click on save. Once you publish, if we go to the next one, share your DSP status. Multi-sites, tell your branches, tell your registered managers. I mean, they should be involved in it anyway, because they need to know, what policies are where and such like. Download your certificate to prove your DSPT and share that certificate with your local authority, CQC manager, your users and their families, so that they know that you are keeping your data safe and secure. Add your DSPT status to your website or your privacy statement. Include it in your bids and tell your commissioners, tell your NHS partners, and tell your IT suppliers. Sing it from the treetops. You want to be proud that you've done this. Okay. The next slide. Making it real. So keep your DSPT up to date throughout the year. It's easier to republish. Ensure managers and staff understand what's expected of them, so revisit things if you need to, and enable managers to access the information. Consider have a printout of the documents or rated policies and procedures in a manual, useful for CQC. And I have one provider that did just that, so that if CQC came in and asked to see the DSPT, she's got it there to hand, and she can just hand it and they can look through it at their leisure, and they've got copies of all the policies and things there. But you don't have to do that. Just whatever's easier for yourself. Okay, and your next steps. So your next steps are register on the DSPT, contact whoever you need to, should you need to. Large providers, there's help at Digital Care Hub. Check out the guidance and start to answer the questions and return to it later. Okay. And that is the end. So I don't know if there's any questions, Rihanna.
No more questions. Thanks
No
so
more
much, Angie.
questions. Okay. We're just going to do a little poll because we're running out of time. And if you could answer that, and then we'll finish off. So the questions: what impact has this webinar had on your confidence to complete? How likely it is that you will complete and publish? And how likely is it you would contact your local support organisation? And would you recommend this webinar to colleagues? And where did you hear about this? Just to help us out for when we're planning our next lot of webinars. Okay, so got 20% very likely, 50% likely to contact the local sport org. 100% would recommend the webinar to their colleagues, so that's good news. Again, any help, we're out there, so don't do it on your own. Use that help, it's free, and while it's free, just keep using us. And thank you for attending. And look forward to seeing you on another webinar. Thank you. End the webinar.